If you want to engage, if you want to engage in the chat, go ahead and you can just put down questions as we go. So we'll collect all the questions. We'll have time for a Q&A at the end. I really want to let Hussein and Callum talk. So I'm going to do a brief intro now, and we'll get right into it. So let me go ahead and get my screen share. All right. Is my screen up, everybody?
Yeah,
Yep, I
Thumbs
can
up?
see it.
All right, cool. Awesome. Okay. So, welcome everybody. Thank you very much for coming today. Today's webinar is called Moving Primary Care, Embedding Movement into Your Practice. And I just want to talk about the genesis of this and where it came from. And then we can let it begin. So the why of this is we've been having lots of conversations with GPs and other people who are working at local surgeries, and a lot of GPs who see the importance of physical activity but don't know where to start. So really what we wanted to do is we just wanted to create a little bit of a forum for all the people who have we've been speaking with, but we also wanted to make sure it was open to the public as well. So don't worry, even if you are not a GP or a medical professional or practitioner, I think you're very welcome to stay, and we really want to use this as an opportunity to share perspectives. The big questions that we kept on getting, and what I think Hussein and Callum are going to talk about today, are what resources are already available for GPs who want to start incorporating either exercise or physical activity into their practices. Um, Often there's a fear of not wanting to reinvent the wheel. And what I mean is, quite often people will try to start their own walking group and then they'll realize there are already resources out there, or promotional materials, or communication materials, or they can learn from other people who've already done it. So I really want to talk about that. One of the big ones that comes up all the time is avoiding burnout, and also working with the community. So one of the things we hear all the time is, I feel like I'm in this alone, or I feel like a lot of this is resting on my shoulders. How can I get it so that not all of the physical activity and exercise practices are being funneled through me, but how can we sort of distribute it amongst the community and other members? And then the last thing that comes up a lot are GPs or surgeries that already have successful walking groups and how they can move beyond walking groups to create other opportunities. So, for non-practitioners, like I said, please stay. This is an opportunity to learn about conversation amongst medical professionals. It's also a great opportunity to learn how to get involved. So I think this will be interesting for everybody, and everybody is welcome. I'm going to go ahead and I'm going to stop my screen share now because I want to pass it over and do a brief intro. So a lot of people here will already know we're very lucky to have Callum Leese and Hussein Al-Zubaidi today. And they've both been on the podcast. Most of you have probably heard them speak before. They're really great, just really enthusiastic champions for physical activity and community involvement. So I just want to open it up to them. They've got a presentation prepared. If any questions arise, please do go ahead and pop them into chat, and I'll just hand it off to them. So thank you very much.
thanks, Andrew. We're kind of both kind of like capacity as GPs, but also I work at the Royal College of GPs as the National Physical Activity Lead. So I'm going to share some of what we've been doing with the Royal College and how that interplays with a lot of the other resources that are available. So I'm sorry, I'm Callum. I'm a GP up in Aberfeldy and Kinnock just on the kind of southern edge of the Cairngorms. I'm part-time academic and I, as said, work for the Royal College. Hussein.
Hi, my name's Hussain, based in the West Midlands. So practice based in Leamington Spa, which is sort of South Warwickshire. Like Callum, I am one of the Royal College of GPs Lifestyle and Physical Activity Champions. I work at Parkrun as the Health Partnerships Lead, and I'm one of the medical advisors that sits on Swim England's Health Commission advisory role. I've got other roles sort of within media and within education and that kind of stuff, but it all keeps me busy.
Hussein is the ultimate portfolio GP. I think we did a whole presentation on what he does. But
Um, Callum, just to
yeah,
quickly, your mic is sounding a bit like you're sort of underwater. It was
oh,
fine a
I'm so
minute ago,
sorry.
but it's
Uh,
going in and out a little bit.
I don't know why that is. Let me.
That's very clear there.
Is that better? Is that all right?
Yes. Yeah, that's better.
Uh, just we always start with a disclaimer. We're both pathological enthusiasts. You know, that comes with pros and cons, but we we don't see ourselves as experts in any capacity really, and we feel we can probably learn as much from you. So please use the chat for questions, but also use it for suggestions, and we can learn from each other, and we can definitely benefit from your feedback. So basically, we're just going to look through some of the stuff we've been doing at the Royal College, particularly the Active Practice Charter, some of its core elements, but also the toolkit that's been developed and the interplay with other resources. But the most probably biggest take home from that we can hand over is that active health professionals make active patients. Do you think that's right, Hussein?
100%. 100%. And there's so many complex reasons for that, but even from just the confidence perspective and that sort of self-awareness of its importance in someone's own life, I think we will naturally always bring those elements into our professional life, no matter what we do. And that's not just purely in physical activity, that's across the board in health. Our sort of past experiences will shape our views and where we sort of explore in terms of our professional work.
The research shows again and again that the more active we are, the more likely we are to promote physical activity to our patients. So with that in mind, please join us standing, turn your cameras on, and just for a quick 30 seconds of squats, chest over your lunch break. Jill, your head's not bobbing. Perfect. 15 seconds left. That's great.
Busted. I was letting people in, I promise.
Oh, last few seconds.
I
Brilliant.
swear this timer is slower than it should be. Whoa, there we go.
Oh, perfect. There we are.
He never
Brilliant.
stops going. I've tried, but he literally never stops.
Hussein, can you tell us a bit about? Oh, I'm out of breath, so I'm going to hand this over. Throw you under the bus.
Yeah,
Tell
of
us a bit about the
course.
active practice charter.
Of course. Okay, yeah. Active Practice Charter is essentially a very simple initiative trying to encourage primary care, not just to increase physical activity levels, but actually help to combat something that's even more dangerous, which is physical inactivity. And that's why, if you see in the criteria, if you bring up the five, Callum, we've got stuff, yes, on increasing physical activity in staff and patients. That's brilliant. But we've separated out sedentary behavior because they are different things. You know, you can, for example, go and do your 5K in the morning, go to work, sit at the desk for about 10 and a half hours, as one study by Richard Main based in Northern Ireland found that us GPs were doing. And then, yeah, you've got some movement in, but you've got a lot of period of sedentary activity, and that is harmful in of itself. It's associated with 1 in 6 deaths in the UK. So we've got the sedentary component, we've got the physical activity component, and if you look at the bottom there, we've also got partnering with a local physical activity provider, because this isn't about GPs becoming gyms, run clubs, or walking clubs. You know, that's we don't need to be doing that. We've got enough already. But it's more about how can we collaborate with local voluntary sector, commercial sector, physical activity offers, whatever shape they may form, in order to have more pathways. Because we know that there's activity on referral where you can do sort of specific programs. Often it's to your local leisure centre for like a 12-week program. Great, that works for some people. But we need more informal kind of arrangements where there's flows of patient referrals, whether that be by self-referral, signposting, or even a form where they can go to other activities. That's a nice widespread. And I think that's really key that we include that in that criteria. And I'm glad that's there, even though most find that the most challenging element.
And I think it's kind of often it's a short-term effort to find out what resources are available, but with long-term benefit. And
Mm.
what we don't want is people feeling like they need to go out as GPs or health professionals and set up running clubs or sports clubs or activity clubs, because actually what we want is people to kind of see what's out there already and hopefully engage with that and save themselves time in the process. So a little bit about bit more about what it involves. I think Hussein's covered most of this already, but it's free. There's loads of resources up online. We've done some research that was published in a journal called the BMC Primary Care, looking at the Active Practice Charter, and obviously there's always more work that can be done, and there is some more research going on at the moment through the University of Exeter. But one of the clear take homes from staff and patients was, or particularly staff, was the impact on staff well-being and staff culture. I think that feeds into the previous kind of conversation we've had about the importance of staff physical activity, and if we can change the culture within the practice, hopefully it has a wide impact on patients as well.
And Callum, can we just go back one slide? Because
Yeah, of course.
if you look at the picture at the bottom of the slide there, and I think we're going to be talking about this in future, so I wanted you guys to image. But on the bottom picture, on the far right, there's a gentleman there who it's called Mick Hurrell, but we call him Mick the Stick, because he's obviously obsessed with Nordic walking. You could probably work out from his nickname. And in fact, when we started a lot of the physical activity projects that we do at our practice, and that's literally at the front door of Clarendon Lodge Medical Practice, it was, in fact, a patient who is Mick Hurrell, a personal trainer who specializes in particular in those over 55. He does things like Nordic walking plus a number of other elements. But he really helped start our kind of informal referral program where now we've got, over a dozen mix essentially with different areas of expertise, different styles. And it was him reaching out. In fact, he sent us a tweet when, it was Twitter back then. It wasn't as awful as it is now. Just messaging the practice, saying that, he'd love to explore how he could work with the practice. And do you know what we did to that tweet? We didn't respond to it, okay? Because I don't think anyone really saw it and no one was actually manning the tweet. So he then came through the doors and he asked, can he speak to the practice manager? And the practice manager speaks to him. He's all very polite, and he goes, "Do you know what? That's it. Just sounds a little bit like it's not really our core priorities, etc." And he was coming down the stairs, and I just heard him like ending the conversation very politely, and he was sort of ushering through the front door, and I just, oh, you're talking about a physical activity group, and at that point, I hadn't done anything too much, but I was definitely interested in lifestyle medicine, interested in movement. And we just went for a walk. I said, okay, my clinic's just finished. Let's go for a walk and let's discuss. And I think this is one of my tips that I just want to bring in at this point, which is often the best connections are formed by just creating relationships. So me and Mick sort of built up a bit of a friendship. We had a lovely walk. We sort of chatted about it. And over time, it wasn't instant. Over time, I go, do you know what? Let's see what we can do. Let's see how that can start. And then it kind of snowballed from there. And that led us down a very long and complex road, which we can probably come onto later.
Great. Thanks, Hussain. So, quick cover of the benefits. We talked about trying to improve health and well-being of patients and staff. There's the support, the move towards personalized care, social prescribing. One of the big things is strengthening those connections, hence the fifth criteria. And we think that's really important. And in that fifth criteria, we talk about partnering with outside organizations. Just under 75% of active practice charter practices are linked with park runs, and that is their piece. But actually, there's loads of other options, and we'll talk through them shortly of different things we can go. We've just done a piece of work. It's not published yet, but there's a correlation. I stress that the correlation is the important word between active practice, charter, attainment, and CQC and patient satisfaction scores. So don't know which direction that goes in, but there's definitely some kind of correlation there. And these are the active practices in the UK. You can see there's a pretty heavy predominance in England. And Scotland, sadly, I disappointingly, there's a few less, but we've got less people, so maybe that's self-explanatory.
Yeah, I need to sort out Cumbria. I just didn't realize Cumbria is literally blank. Like, surely that's like natural, hotspot for. Okay, I'll sort that out. Leave that with me.
Appreciate that. Yeah. So we've now got just about 600 active practices in the UK, which is brilliant. So it's been growing. And so one of the big things that we really seek to do through the Royal Colleges is to share stories of good news and hopefully put people in touch with each other. So we have a newsletter, a quarterly newsletter. And I think that's a really core part of what we do, because as Andrew alluded to at the start, I think a lot of physical activity promotion in practices, and Hussein, I suspect you might have experienced this initially, is led by one or two individuals within the practice. It's quite dependent on one person's enthusiasm and drive and motivation. And if that changes or life circumstances go, or eventually you just kind of, sometimes you just think, oh, what am I doing? Am I just knocking my head against a brick wall? But there's a network of people around the UK doing it and being successful. So yeah, we want to share those good news stories. Does that resonate, Hussein?
Yeah, no, definitely, definitely. And so it's really important that they find the tribe because it may not always be in the practice or PCN that they're working on where they've got like-minded people passionate in the same area. So if you can find others that you can, create that community and share ideas and keep you motivated, then yeah, it'll help.
So I think moving from what it's about to much more practical stuff. Hussein, when you're at Clarendon Lodge, what
Mm.
did it look like practically to implement the active practice charter? What kind of things were you doing on a day-to-day basis to encourage movement and reduce sedentary behaviour?
Yeah, absolutely. So if I think about when we applied, which is obviously quite a few years ago now, we weren't doing as many things as we do now. But at that point, when we kind of wanted to meet the criteria, some of the first things we did was when we had staff events that we had throughout the year anyway, let's say Christmas do, summer specials, the kind of staff get-togethers, we incorporated movement into them. So, like our summer do then became what's the is it frisbee golf? Yeah, that's the one. Yeah, we throw a
Yeah,
frisbee
yeah.
into the hoops. I wasn't particularly good at it, and so we sort of getting in movement, and we always try to find a movement that people enjoyed, rather than it's we're going to go on a staff run or etc. That's not going to be accessible for everyone. So we found sort of dancing. We did frisbee golf. We did a bit of crazy golf as well. Just bringing in sort of movement in different forms into our staff events. In terms of supporting our patients to become more active, we had a lot of material in the waiting room with, for example, videos on the waiting room, just going through some guided chair-based exercises, also connecting those movements with some evidence in terms of, where does that impact happen? We didn't invent them. We essentially got them from We're Undefeatable campaign, which is done by the Richmond Group of Health Charities, and it's a great resource with lots of various different flyers, posters, and adverts that you can pop on your TV screen. And in terms of partnering with a local physical activity provider, we did that in two forms. One was with our local parkrun event team, which was brilliant. And in fact, we invited them into the practice in order to give a session to the staff to let them know that this is more than a run in a park. This is a place where you can walk. This is a place you can volunteer. And we got the staff to do a takeover, which was great. But then for some reason, they decided on that takeover to also test the first aid. Like, I don't know if you know, but parkrun events, they do like a simulated pretend cardiac arrest just to ensure everyone knows what they're doing. So they, I think as a joke, tried to get all the doctors to see if they still knew their first aid, which I can tell you we did. And the other was Mick. So as I talked about before, Mick the Stick, we partnered with him and he supported us in getting some walking groups off the ground and linking already existing walking groups to us. For example, we even shifted the location start point to something that met kind of most of our patients' needs.
Cool. Oh, amazing. And I know it's grown and grown and you've got a sport in mind t-shirt on. One of the things that Hussein persuaded me to do in my practice was set up a walking and running group through Sport in Mind called Run Talk Run and Walk Talk Walk. So Hussein does it on Monday night. So do we up here in Aberfeldy. We meet at 6:20 on a Monday night and we have a walking group and a running group. It's not a numbers game for me anyway. Sometimes it's just me. Sometimes there's eight. It totally depends. But that was inspired by Hussein. I So there's loads of things you can do, and it grows arms and legs or time. But I think what we just want to stress is that it's attainable steps. We will cover the real undefeatable stuff. I think that is really interesting. The resources are out there, and hopefully we'll come on to that now. So we've talked about community connections and why that's super important. So we won't go through it anymore. But up on our website, loads of resources, some of which Hussein has a lot of them he's tried and tested already. So there's posters and flyers already on the website. So you can go on there, you can print them off, put them up on the website, put them up in the waiting room. Social media stuff, so posts, SMS templates, Hussein, talk to us about population searches.
Yeah, yeah, absolutely. So population searches are essentially on your clinical system. If you want to identify specific populations that have high health needs or where we know movement's going to have a real impact on the condition trajectory, then we've created some examples. And really, this is just to get you thinking and using. But we do that to ensure that what we offer is being made aware to those that need it most. Because what we found when we had a sort of self-referral mechanism and also healthcare professional referral, it was great. We were getting attendance, but it often wasn't from those that needed it most in certain communities around our area. In particular, we have a deprived area that we cover, which is Lillington, which is a bit of a hotspot in compared to the rest of North Leamington. And they just weren't coming when we were looking at the postcodes doing the analysis. So what we did was we did searches to try to identify people with long-term conditions with those postcodes. And we then sent out messages in order to encourage them to come to the group. And we found that that vastly increased the number of people from that background. So trying to get a bit of a balance to really give a bit more of an equal approach.
Right, thank you. Here are some of the posters and flyers. They look great. We
Mm.
could take no credit. The RCGP team have done some really brilliant stuff. You can personalize them. So there's one on the far right is got a space for kind of personalizing what being an active practice means to you or how you implement it. Social media assets. So these are our Instagram templates that you can use and just post up on Instagram, social media, anywhere. Some great SMS templates. Have these been tried and tested in Leamington, Hussein? So yeah,
Yeah, yeah, absolutely, absolutely. These are my text templates that I
yeah,
then popped on for the resources. So yeah, like it's just trying to use positive language, not trying to sort of shame when you're thinking about long-term conditions, etc., and frame it as kind of movement that is hopefully going to be enjoyable and something that relates to them. And I think the key here is that we want to ensure that these messages are going to the right people. So it really is key that when you're doing your search, you're identifying those where it's appropriate and those where it's inappropriate to send the message, because you can definitely send an inappropriate message at the wrong time if you haven't done that.
this is one specific for parkrun. So
Mm.
same kind of idea, which is great. So please do go on our website. Patient resources. Hussein has mentioned the We Are Undefeatable resources. They're brilliant. They have got videos, posters, leaflets that you go on the website. You can put the videos through your TV in the waiting room, get some posters up. Uh, this is I'm doing a bit of research at the moment around waiting room design because for a lot of us time's really challenging, and so can we just do stuff in the waiting room which promotes physical activity and has an impact? And this has come up again and again. Can we have videos? Are they available? And they're here. There's been a few other great ideas like getting a golf simulator up in the waiting room. I suspect that was from someone from like St Andrews, I reckon, who wanted that. But anyway, so yeah, it'd be great to hear what you're doing in your waiting room and if you've got any kind of cool, innovative stuff that you're doing to try and
Mm.
encourage physical activity promotion. Have you seen anything interesting? Come across anyone? Maybe he's got kind of static bikes in the waiting room or anything else?
What have we seen? We had one surgery that removed like half of its seats and turned it into sort of standing, sort of in a stretch area, just to try and encourage people to spend less time sitting down. And they actually found that they didn't, apart from a few upset patients, most actually really enjoyed having the opportunity to have a stretch and that kind of mental note to do that. And just
Interesting.
quickly, in terms of the We Are Undefeatable resources, they now have an app. So they have a free app which is been designed by Good Boost, which is an AI-based long-term condition company, and it's really good. I actually use it for myself, although it is specifically designed for those with long-term conditions or need support getting active. But it helps to sort of understand and produce workouts that are sort of specific to your current needs.
It's really amazing. It's super tailored, isn't it? So when you start, you put in what long-term conditions you have, and then you do a range of kind of mobility tests. So you put in what your mobility is like, and then it asks you for goals, and then it produces something that's really specific to your
Yeah,
needs.
yeah. Yeah, it was really good because I fell off my bike last year, and so I fractured my clavicle. And that whole process coming back, I used the app quite a lot just to sort of help me get that sort of range of motion in the shoulder.
Mm. Uh, just a bit more on the We Are Undefeatable toolkit. So this is just, give it. We've talked about this already. The web links at the bottom. So do jump on that. We'll make these available. They're already available online, these slides, but I'll send a link to Andrew and you can jump on, have them and find the link. Moving Medicine is a brilliant resource that
Yeah.
if you just Google it, it will come up. You've just relaunched, and it's a brilliant web page which basically exists to try and support health professionals to promote physical activity across a range of conditions. And so, if you go on, you kind of find or you search by condition. So if you've got someone with type 2 diabetes, then you can go on there, and it's got questions, advice that's specific to that condition, and it's also got it frames it in such a way that depends on how much time you have. So if you've got a short period of time, 1 minute, slightly longer, or a really long time, which a lot of us don't have. So yeah, it's brilliant. Hussein, you're doing some work with them at the moment as well to kind of create and tailor a new face to that website as well. So there's lots happening in this space, and Moving Medicine are really kind of leading the way in it. So please do check out that website. Brilliant. We've been through population searches. We've talked about parkrun practice. Parkrun briefly, but Hussein, do you want to just give us a kind of a 30-second elevator
Absolutely.
pitch on parkrun practices?
Yeah, absolutely. I think parkrun practice is often the easiest first step with a practice that is finding it difficult to take on anything. So let's say you're contacting them, you're trying to reach out and support, and they're just like, well, we don't have time, etc. Because with the active practice charter, you need to demonstrate that you've done something and that something is recurrent. So it can't just be one-off things. Otherwise, the application doesn't get accepted. They need to demonstrate that they're meeting the five criteria continuously, not just once. And so with parkrun practice, it's very simple. It's that they are going to be more closely aligned with the local parkrun event to signpost and refer patients there. Now, how that's done, it's up to them. They could do that with, for example, just waiting room flyers or a TV ads, or they could mention it during their consultations, or they can send text messages out, or you can get some practices doing far more, where they're, for example, doing takeovers of local volunteer teams, where they are putting on sort of group consultations to explain the importance of community and volunteering and doing a sort of a path to park run, essentially supporting their patients to attend. You have the full range. And we have now over 2,200 practices signed up to the Parkrun Practice Initiative. And this last 12 months has been the busiest year in terms of signups. So there is increasing demand. And I know that it seems like surgeries are super busy and don't have any time, etc. But often, even in those times, and we've always been busy, let's be honest, we still do need to ensure that we are connected to our community. And most GP partners, they want to feel like their practice is part of the community. And so things like this can help.
Yeah, it's amazing. A third of all GP practice now are parkrun practice.
Mm, yeah.
There's a lot of momentum, and it's now in Australia and Ireland. So yeah, international traction as well. Uh, Run Talk Run, we've talked about already. It's a charity that exists to support people with mental health challenges to be more active. It's for everyone. You can run or walk. Anything to add there, Hussein?
No, yeah, that covers it. Remember, so they do the run talk run element, and that's for Sport in Mind. Sport in Mind do other activities, really quite a broad range of types of movements and sports, predominantly with those with severe mental illness in secondary care settings, so inpatient hospitals, etc. And some of the work that they do is absolutely amazing. Very grateful to support them in some of that. In terms of the mental health swims, this is a bit of a sad story because mental health swims has been doing some brilliant work. They had over 150 locations, predominantly open water, apart from one site which was in a pool, which was our one, which we called Swim Together. But sadly, it was maybe 3 or 2 months ago, that charity's closed down due to lack of funding, which is a huge shame. But fortunately, our swim, which was kind of indoors at our local leisure centre, has continued because we've sort of set up a relationship with our local leisure centre provider, and we felt that it was really bringing benefit both to the PCN, the leisure centre, and the patients. So that's something that we find really helpful because for many, they don't want to join our walking group or our running group, but they really do resonate with swimming, and we have a 3 month waiting list to get people into that group. So it really shows that there is demand there.
From England, I've created a suite of resources called the Water Wellbeing Programme, which is to encourage people to get into pools, people with comorbidities to get into pools. So there's lots of information, lots of help. It's worth kind of checking out those resources because there's definitely support to partner with local pools. Hussein, active partnerships. This is an English thing. This is,
Yeah.
there's kind of a four countries divide in some aspects in this, but
English
active
in Wales.
partnerships.
There are active partnerships in Wales
Sorry.
now, although
Yeah,
they're much
yeah.
newer.
But
So
yeah,
they
you
cover
tell us
different
about this.
regions. They
Yeah.
cover different regions. In England, there are 43. My one is Think Active, which covers Coventry, Solihull, and Warwickshire. And active partnerships are predominantly funded by Sport England, and they're there to try to, bridge the inequality gap when it comes to physical activity. Some of them will have a very strong health focus. I'd say maybe two-thirds or more will have a strong health focus to what they're doing, and some they have priorities elsewhere when it comes to physical activity. But for me, they have been instrumental to supporting us, not just in understanding the landscape and what is locally available to us, but also in providing training to staff. Most active partnerships will have a training element to support healthcare professionals to understand physical activity, etc. And also with funding. So either funding directly from the active partnership with grants or directing us to where other funding is happening, like local councils, sport legacy funding, etc. And we have managed to secure a lot of funding over the years through basically just doing it. The amount of places that say, "Oh, I struggle to get funding." I'm like, "How many funding applications have you completed?" They're like, "Oh, I haven't done any for 4 years." Well, when you do about eight a year, you do get some. Even if you get one or two coming through, that makes a difference. So I think with funding, you do need to put effort in if you want to see output.
Yeah, I agree. And if you do it once, you can just rehash the same application. So you
Oh, yeah.
can kind of submit the same thing. So the effort is actually just doing it the first time, and then all you got to do is change the word count for to fit the different boxes in the subsequent applications. In Scotland, the local councils run the health have kind of the leisure centre provision. Uh, so in Perthshire, we've got Live Active. I've been in more and more communication with them. They can be really helpful. So do reach out to kind of your physical activity leads in the local leisure centres wherever you are, if you are in Scotland. Great. Hussein, anything else you want to add before we head over and take some questions here?
Yeah, I would say just the last one on active partnerships is if, let's say, you're not an active partnership and you're not currently a healthcare professional and you want to support your local healthcare team, surgery, etc., to increase activity, I would look to do that through the active partnership. And I think it's one of the reasons why, when we look at that map, England has far more active practices than the other nations. And a lot of that is because active partnerships take it upon themselves to support practices to become parkrun practices, active practices, etc. And that can help to lighten the load for the surgery rather than the surgery feeling like they need to do everything. So it really helps to kind of make those shortcuts, and they go, "Oh no, you don't need to do that. That already exists. This is the training that already exists. These are the resources that already exist." So for Wales, where these are relatively new, it's been around for about 4 or 5 years, and in England, where they're well established, definitely get in touch with the active partnership. They will be a real merit.
Yeah. Well, I think that's probably a good place to finish. That the active partnerships have a real knowledge of the local offering, and
Mm.
we have provided a lot of what those national offerings are and can support. But actually, finding out what's available locally is really imperative as well to make sure that you. It was one of the things at the start you mentioned, Andrew, is making sure we're not duplicating effort because actually, there's a reasonable chance that things are happening that you're not aware of where you live. So, bro, we'll stop there. I'll stop sharing and happy to take any questions.
All right, great. Thanks a lot, guys. That was really great. And we've had a very active chat. So I'll go ahead and start going through the questions. We had some questions sent in, but right now I'll just prioritize questions from the chat. And just let everyone know that this is recorded, so you can go ahead and check it out if you want to rewatch. Because there have been some really good resources shared, and we'll go ahead and make sure there's an email as well with some direct links to the resources. So, first question I've got is from Kira, and I think it might have been answered down the road, but it's the first one, so I'll go ahead and address it. And she says, "What does being an active practice mean? And then she says, do you know if they are active, active? So I think she just want a little bit of clarification on what it is to be an active practice and what that actually looks like, in the real world, boots on the ground.
Yeah. I can take that one. So, an active practice essentially at the sort of at the lowest point is they have shown evidence that they have fulfilled those five criteria. So, in a way that they have increased physical activity for staff and patients, they've reduced sedentary time, and they've partnered with a local provider. Now, do we check that they have definitely done this? No, we do not send Hercule Poirot to sort of double check that these things are happening. We take faith. We hope that the Hippocratic Oath is still in full force. But I think it's what can happen, and I think that is just life. Over the years, you can have different outcomes where some practices start off great and then it declines, the kind of momentum goes, maybe key members of staff now leave and go elsewhere, etc. Some practices kind of stay where they are and they maintain it. And some, like my own and many others, will actually use that as a springboard because at the end of the day, the active practice charter can be some very simple things that you've done, which is very worthwhile. But it can then lead them to then take on more and go further and develop that. And I think that's the key. What we're trying to understand and evolve to as we look to grow the active practice charter is how can we support more of these practices to go for that option, for that to lead to slow, continual evolution and growth. That's going to be the real key.
Cool. Kira, I see that you're off mute. Anyway, do you want to do a follow-up there, or did that answer your question?
I don't know if you can you hear me?
We can.
Yeah, no, yeah, active, because we've seen when we've approached GP surgeries about active being a parkrun practice, and they've said we are, but then when you dig a bit deeper, they've signed the form, and then they had, like Hussain said, they haven't had the capacity, or that member of staff who did fill in that form has left. And I think that is the challenge going forward, that you hit upon a really great member of staff who's driven by physical activity, and then sadly they leave. And so then all that work that you've done up to that point
Yeah.
stops.
Yeah, I think this theme of sustainability will come up a lot because I think that we've all had that experience of just having a really enthusiastic champion, and then
Here,
it just
I
disappears.
would say don't lose faith. I think enthusiasm waxes and wanes depending on our clinical workload. And so it might be the right person at the wrong time. And so, keep knocking on doors. And I think you really struggle to find a GP who doesn't acknowledge the power and importance of physical activity. You're just struggling to find a GP that has the headspace and the time. But as we say, that can change, and right place, right time, and it might be a gold mine.
Yeah. And sustainability is the key, and it's also really challenging because I remember, about 2, 3 years into kind of the journey that myself and the sort of practice and PCN that I was in, like I can't remember who it was, but someone told me, do you know what, saying if you left tomorrow, this would all be over. Like it would be gone, and that struck a chord. And so I actually reached out to my active partnership and I said, how do we achieve that sustainability? Because it does really feel like, I'm integral to what's going on. And they actually supported me with funding to spend time with a sustainability consultant. I didn't even know they existed. And he met up with me every 4 weeks over a whole year. And it was incredible with what he did because it completely transformed kind of how I delivered what we were delivering. And now, God forbid, don't tell them, but if let's say they got rid of me or I went, it would still keep going. I'm no longer like a key part of it. Like I often just go and I just feel like I'm not even needed, to be honest, anymore.
That's a good feeling. Um, So yeah, that's good. I think a lot of people probably didn't know that there was that offering of a sustainability consultant. That sounds like a very good resource. Next few were just a lot of people just chiming in to say their love of Nordic walking, so that was good. Bridget was just saying that she finds the We Are Undefeatable resources very useful, so that was good. And then I think it's Zoe. She has a question, which I think I know the answer to, but maybe we have a good follow-up as well. She asked, "Is joining the charter available to bodies other than GP surgeries?" And she said she's an osteopath and a lecturer. So she was just wondering what other opportunities there are for people, or maybe related organizations or complementary organizations.
Yeah, I'm happy to take that one. It's a conversation we've had a few times, Zoe. Just the way the structure sits at the moment, with it being the RCGP, the short answer is no. But the long answer is there's nothing to stop you from implementing it, even if you don't get the official kind of the official bit of paper. And yeah, I'd really encourage you to do so, or look at other opportunities, because I think there's things out there. And so Moving Medicine have got an active hospitals page on their website, and so if you're not a primary care centre, they have an initiative aimed at secondary care. So I would check that out. Hussein, any other kind of resources or partnerships that you're aware of similar to the Active Practice Charter? I think
Yeah,
active
not
hospital is the main
specifically that
one.
has sort of like that names a sort of achievement kind of process, but as I'd say, like 'cause for example, at Parkrun, we get a lot of other organizations, let's say physios, OTs, etc., saying, "Oh, can we have the same thing as Parkrun practice there?" And I think that what we've started to realize is that the certificate is meaningless. As you know, if you choose to partner with local physical activity, whether that's Parkrun, whether that's something else, that's the gold. You know what I mean? Having the no one looks at our certificate, even though we put it in the reception room, let's be honest. But so it's about how do you make that kind of key? And so we've decided not to just form all this sort of park run physio and park run OT and that, because we just feel that it doesn't add anything beyond that.
Yeah, that makes sense. The next few questions are sort of thematically joined together, and I think that this might be one of the major thrusts of the conversation that came in through chat. So I'll read Fiona's out, and then there's a few other people who chimed in. She says, "I run a health walk program across Fife with 25 walks every week, led by volunteers. I've also run a reducing sedentary behavior campaign with training leaflets to share." A strength and balance challenge. It is funded by local council in partnership with the NHS. I also work with groups such as Park Run, Walk, Green Health. And here's the question. My biggest issue is getting into GP practices. Receptionists won't allow me to leave information. GPs are often too busy to chat. It's very frustrating. And then different versions of that, of GPs also saying that, again, resources and capacity are stretched. Fee says, yeah, I have the same problem. Whirl, I do the same job as yourself. It's so hard engaging with GP practices. And then further down, like I said, some GPs were just talking about just oh, here's one from Anna. I think GPs surgeons are so busy just fighting the fire day to day that nobody has the mental energy for extra things. I agree. This is really important, and I have a lifestyle clinic at my surgery. I'm a GP. I have faced such resistance, lack of motivation from patients and staff. It's hard not to give up. There are some local walks classes, but people won't go. So it's a two-parter. And what I'd really like to do is just talk about some of the frustrations or challenges or friction that's involved in local communities interfacing with GP surgeries, and then perhaps just to flip that on the head and just to talk about some of the challenges as you have already, but I think it's worth bringing up Anna's point about maybe lack of engagement. So both parts. So first one, I'll throw it out to you, and then when we're done, we'll jump to the second one.
Yeah.
You say, do you want to take it, or should I?
Yeah, for sure. So on that first part, like getting through and communicating with the NHS in general, including primary care, is challenging when you're not within the system. Now, there are some tips that I would do. One would be what essentially you're trying to do is pick in, let's say, if we had the needle in the haystack, essentially, of the person that has got the passion, the interest, and also the headspace to do it. So, how do you try to increase your chances of finding that needle? One thing I would do is at your next local parkrun event near the surgery that you're going to, you ask the local event team saying, "Can I do a shout out before this parkrun?" Very briefly. We do it all the time. And ask, are there any healthcare professionals that are interested in partnering with XYZ, whatever it is that you guys do? And I can guarantee there will be healthcare professionals at that park run, just going about their business, doing the park run. And if they feel like they have the headspace to do it, they'll reach out. So if you do it a few times, a few of the local park runs near where you're doing, as an example, or other community events that are going on, you may find those key people. Next tip is you look to, for example, contact myself and Callum, where you have something that you're looking for. I could, for example, put it on my LinkedIn, where I've got a network of GPs. We can put it on the newsletter at the Royal College of GPs. We can get the British Society of Lifestyle Medicine to consider in their regional comms that they do, saying, look, these guys want to reach out and partner. who's interested? Because the key is it's not just trying to go through the front door. Because the problem with the front door is there's lots of protection. There's dogs, there's alarms, there's all kinds of things stopping, unnecessary bits coming in. So you need to find a way to get into the castle without going through the front door. And so yeah, little tips and tricks like that can massively help. That's what Mick did. He tried to go through the front door, didn't work. But it was just the luck of sort of being around and being persistent that he kind of found me just by chance in the corridor. And who knows what would have happened if 5 minutes had not gone by and I hadn't entered that door at that point. So yeah, you've got to try and find people in those little nuggets. What do you think, Callum?
Yeah, I would totally agree. I think like, the big barriers that you will face is a lack of time, which is really tricky, and people often not having the knowledge, resource, or headspaces within primary care. So my probably tip would be is go with an offer as opposed to an ask. So say, look,
Mm.
we know you don't have much time. We know that preventative health is really important. I would love to run a walking group at the practice for you and really like present it as an offer. Be like, I really want to help you. So I think the other thing that I've learned is kind of be flexible and be willing to kind of to not hold on to your idea too tightly in case that it can be edited to fit the perceived gap from either the community, the health professional. And I think an example maybe I can give is we or I, after Chris Hoy's sad news about prostate cancer, we were seeing loads of prostate cancers. And so I thought, well,
Mm.
I'll do a group consultation for prostate cancer. And nobody signed up, literally not a single person. And and then I got a phone call the next day from a patient. He's like, oh, yeah, I run the men's shed. If you do it in the men's shed, I'll fill it. And I was like, there's no chance of that, but I'll do it in the men's shed. Anyway, I went 2 weeks later and the men's shed was full and kind of just finding the right person at the right time and kind of being, it was a bit of a palaver because it wasn't in the practice and I had to change a few things, including indemnity, which wasn't a big deal in the end, but just be willing to be flexible. And that was a big lesson for me.
Yeah. And if we could move on to the engagement bit, if that's all right.
Yeah,
Like,
do you mind if I jump in and say one thing,
oh yeah,
Hussein?
yeah, yeah.
Yeah, just two things. I mean, Jill and I, our experience has been that most surgeries, obviously being respectful of the staff's time, they often have some time set aside during lunch breaks where they'll do short presentations locally or they'll bring up points. If you can get on the bullet points for that meeting, sometimes you can shave off 5, 10 minutes to do a little presentation, as Callum said about, you know, sort of providing, solutions. That was one, and oh, I forgot what the other one was. So, so I'll pass it back to you.
Just to jump
Oh,
in on that as well, because Jodie's put in a comment saying that if you've got health and wellbeing coaches or social
Mm.
prescribers in the practice, normally you can approach them first. And sometimes if you can't get past the reception, there are other ways in.
Yeah.
From Keith as well, saying try approach the diabetic team leads as well.
that's good.
One other option is we have practice-led teaching days, so the doors close for half a day, often to provide teaching. And you could say, well, look, I run a walking group. Why don't I do a well-being session for half an hour of that? And I'm sure there'd be lots of practices that would be delighted to be able to fill that time.
I
And
remembered my second point, which is what you were saying, Callum, about the men's shed. I think, yeah, just the importance of finding other organizations that are already well established, from a GP, I think, point of view, it's, as we said about not reinventing the wheel, it's so much more powerful, I think, to work with an organization, whether it's Wild Swimming or Men's Shed or whatever, that already has that active engagement and bring it in rather than trying to start from scratch. I think that makes a huge difference. Sorry, Hussein, back to you.
No, 100%. And you covered the first bit of what I was going to say on the engagement front, because what I found from my experience was essentially getting the support of organizations, both sort of local and national, really helped in terms of understanding and learning. So, I remember you mentioned one of the comments, they said that they were struggling with a lifestyle clinic to get engagement, both from patients and from staff. That was very much my experience early doors as well, where you put things on, you think that, this people are going to lap this up and people don't really turn up and staff members don't seem particularly infused or sending them in. And there were a few things that, when I look back now, you realize certain mistakes that I personally had made. And one of them was, first and foremost, like you don't need the whole staff team to be behind something, but it doesn't mean that they aren't aware and there's ways that you can try to just nudge it slightly to make it more supportive. So one thing that I did was, as well as obviously let them know the services that were available, is I gamified the process of sending patients there. So there would be a leaderboard each month to see, whoever signposts the most patients to either our walking, swimming group, etc., would get various prizes, etc. That massively increased the referral numbers, I can tell you that. Secondly, is when you are designing something, like we do need to co-design it, because and co-design doesn't mean doing something and then getting some feedback later. That's a separate thing. So what I did was, when I was struggling to get these group consultations filled, I actually met with a few patients that had attended in some of the very low numbered group consultations, and asked them. I said, look, if you were going to make this group consult, how would you do it? How would you design it? How would you promote it? How would you recruit patients? What would you do for engagement, etc.? And it completely changed how we did it. Like, there were so many things. It was pretty unrecognizable at the end. And it seemed so obvious. And I didn't know why I hadn't thought of some of the things that they'd come up with. But then it was obvious why, because I'm not them. And so as soon as you realize that, yes, I can bring some expertise from a health perspective, but we do need to design things based on what people want. And you can only really find that out by asking them and getting them to sort of do it with you. And since then, yeah, like we've seen a much better improvement. And the best form of promotion is word of mouth. And the amount of patients that come in because their neighbor told them to, or their partner told them to, because they'd gone to a previous group that we'd done. So really try and think, if you are struggling with engagement, how can you change it? And when you are changing it, how can you get others that are actually going to be utilizing the service to design it?
Very good. Okay, next question is from Rick. And Rick's saying, just regarding comments about local physical activity providers already existing, he's just saying, in our experience, this isn't always true everywhere. In some areas where the need and health inequality is the greatest, there's a huge lack of appropriate opportunities, i.e., not gyms, clubs, and those do need to be created and supported. So that's kind of interesting. In contrast to what we were saying before, is what about starting up new things or creating new opportunities if they don't currently exist? Or for example, maybe if a park run might not be supported in a community of a certain size, et cetera.
Yeah, in fact, there have been a few park run practices. We put them right at the top that they've actually created a park run. You know what I mean? Like, we should really give them more than just the certificate we give everyone else. But they've realized that there is no local offer. And look, it doesn't have to be parking. There's so many things that they could pick from. That's just the example I'm using from experience. And yeah, like you're right. Like, there is definitely an inequality in terms of the offer, not just in terms of the amount, but the variety and the safety and the accessibility of those things. And also, an additional thing that I've only learned recently when I was looking through research done by Dr. William Bird, who works at Intelligent Health, where you can also have access to these provision, but it's the perception of it that's different. So he used the example of Prospect Park in Reading, where there is a park run, for example, and he did surveys from various different places and different demographics around the park. And there was a huge variation in terms of how they perceived the park safety, the park's, attractiveness, the sort of the wants to go there to move their bodies. And you could see it as a map. There were certain postcodes where they're of higher deprivation, even though they were right next to the park, viewed the park really negatively. And then certain postcodes where they're actually further away, they viewed it very positively. So it's not just the provision, but it's how do we sort of, how is it represented? How is it perceived by the individual?
Yeah, I
Yeah,
think
I think
that's
a
a
real clear example of that is skate parks in parks. It's a great way of engaging teenagers, but it's known to put older people off. And yeah, I think, Rick, my comment about things already happening was in the context of sustainability. And look, I've set up a running group because it didn't exist. And
Mm.
but that demands time and people that are already stretched. And so yeah, there will be there will be need, I'm sure. And if you have the energy to do it, kudos to you. Get it done, and I will only be here to cheer you on. But just be mindful of and something I'm becoming increasingly aware of with the arrival of children is being mindful of my own time and kind of not burning out because that's the last thing we want.
Yeah, I was going to say regarding William Byrd. Yeah, he really speaks about this just I think really beautifully and thoughtfully. So if anyone has a chance to hear him speak or his work, I'll do a plug that the podcast episode we did with him a few months back. We talk a lot about Prospect Park and feelings of belonging in green spaces, and I think that is really important just to think about all the barriers that might be invisible to us, whether it is, comfort outside, feeling safe, having access to the right kinds of clothes, depending on what those perceptions are. So that's really big. And yeah, and Kira, nice comment here. Perception location comes up a lot in place-based work across the country. Yes. Bethany, ask a question about nature moves. Thank you. I'd be really interested to hear if any nature moves groups are involved with any practices. If so, how did they become involved by contacting practices directly or through public health bodies and local councils? Jill, do you want to take this one?
Yeah, normally we'll contact the practices directly when we have groups that are setting up near GP surgeries, and generally we will go through the social prescriber if it's in England or the link worker if it's in Scotland, and they are quite receptive, but it is often just they don't have time, they don't have time
Yeah.
or capacity. And so the best way that we've found is to try and go and have a chat during a like GP coffee break when they're signing prescriptions, which is a nice way, and you can kind of explain what the offer is, and then they're much more. I mean, it's much easier for them to refer people or signpost people if they kind of understand what it is, and often we'll invite GPs and practice staff as well to come along to sessions as well, because I think it just helps kind of see it in practice, and maybe some of them, depending on the time, sometimes they'll recommend it to a patient, and if they can come too, they'll come too, which is amazing, and that makes a big difference. But the um sometimes you just reach out to GP surgeries and there isn't any, they just have time or space or capacity for anything else.
Yeah, yeah.
Um, there's also just a big problem of sort of funding generally for local groups as well. I mean, like active mental health swims, good example. But I mean, every week at the moment, I feel like I'm hearing of another charity or community group having to stop because there's no funding. But that's
Yeah.
another conversation.
No, yeah, I don't want to end it on a downer, but I was doing some research on certain active groups and working with older populations and everything, and there's so much great knowledge that's sort of disappearing from all these various practices and interventions and communities that a lot of them just haven't, sort of been disappearing, which I think Jill is right. I think that's a conversation for another day about maybe community resilience and other ways. I'm looking over the other questions that were sent in. And most of them were covered already, talking about realistic common barriers to active practices, a follow-up question on environmental barriers, light, walkable areas. Um, Not all communities seem interested in running groups like Parkrun. What are some other options that have worked? And I think, as Hussein also noted, is that Parkrun is very open to walkers and things. Another question was any pots of money to help, and then how to prevent burnout of local champions. Sometimes it feels like it's all on me. So really, I think we covered a lot of the questions here, so I think it might be nice just to get some final takeaways from Hussein and Callum. Oh yeah, thank you. Yeah, if you are in England, the Sport England Movement Fund is
Mm.
one of the greatest pots of money. So we can talk about that briefly. I'm mindful that we're coming up on time, so if in just one or two sentences you could give some wisdom that will fix all the problems and satisfy everybody, if you could.
Yeah, no, 100%. What I would say is you need to set your expectations to a realistic level, and you need to appreciate what can be achieved not in 6 months, but 6 years. Because I remember in the first 6 months of my project, I had achieved diddly squat, if I'm being honest. Like, not much had moved. I felt like I was failing. I felt like this was a waste of time. No one cared about it. But you just keep going, you keep plugging, you learn, and then as each year goes on, you actually make more progress than in any of the previous years, and it accelerates. And it comes to a point, and I think one of the things that the sustainability consultant taught me was that you have to make sure that these kind of pathways and processes that they are meeting everybody's needs. the practices, the patients, the provider as well, who are struggling to keep afloat. And he said that you need to make sure that you make them either money or more sustainable themselves through that program. And so that really helped change the narrative how we design these things. And our key aim is that we want our patients to be paying, and where it's applicable, for these services in a process that works. So we often do, for example, well, they get 4 or 5 weeks free when they're referred through our program, and then eventually they start paying a reduced fee and then a full fee, and it's done in sort of a phased approach. So do give yourself that time to go, do you know what? It's very difficult, it's very challenging, but over time you can look to add on. And where you meet a complete block, then know that you need to change tactic. Maybe you need to go to a different place. Maybe you need to try a different approach. And one thing I'll say as the last is offer them a free session for the staff as like a well-being event, because this is things they have to pay for, and we are currently strapped for cash as partners. So if you can give them that tick and you use it as an opportunity to change their minds while they're at an event, then you've got a whole group of professionals all in one go that you're doing them a favor, and they will retain that. That will be sort of in the bank that you can then use later down the line. Quite a few of our providers did that for us.
I think for me, 2 points. First of all, if you're not a healthcare professional, that if you're trying to offer something, present it in a positive way and present it probably around two things. One is around staff well-being, and the other is around preventative health agenda. So they're your two tickets in. Make sure it's an offer, and kind of maybe even identify that we acknowledge time's a challenge, so we want to do this for you. If you're a health professional, what you do matters, and so be active, and don't be kind of be very unashamed about that. Make sure that people are aware that you're active, and make sure that your smelly trainers are on show in your consulting room, and your helmet's on the hook.
Right.
Great. Jill, I saw you had your hand up. Did you
No,
have
I
something else
didn't
you
mean
wanted
to.
to
I
say?
was just pressing
Oh,
buttons. No.
okay, sure. Well, yeah, just thank you so much for making the time. We really appreciate it. Thanks for everyone who showed up and participated in the conversation. And thanks as well, obviously, to Callum and Hussain, who just gave some really great just ideas, resources. Yeah, I found it very helpful. So hopefully everyone else did as well.
And we'll send around the recording and some takeaways as well, probably tomorrow.
And Andrew, share the slides as well
Yeah,
if
yeah, we
Oh,
can.
great. I was going to ask. Okay, yeah, we'll go ahead and share the slides because there's a lot of good information packed into them. Thanks for providing them.
Great. Thanks very much, everyone.